And sometimes they would tell me stories about their crime. And they wouldn't exactly say they're sorry, they would just shrug their shoulders and accept it. So then I got on drugs, you know, I mean, it was a living, and, you know, some of the people who had been homeless explained, I didn't have a job, I didn't have a home, I was under the bridge, I was hungry, and some of the other guys were hanging out there, and I hadn't seen my wife or kids for several months, and the guy next to me says, hey, I got a hit for you, man. You want to pop a pill? Well, we'll drink my whiskey. And I did. And you know, it was the only moment for the first time in weeks that I felt completely free, completely relaxed. For a minute, nothing hurt. For a minute, I didn't care that I was in this situation. So the next night when he offered me more, yeah, I took more. And the more I took, the more I wanted, the more I wanted, the more I took. And pretty soon, I couldn't get anyone to give me any more, and we were all scuffling to get it. So I started selling it and dealing it. And when I couldn't sell it and deal it, I stole things and I sold them to get the money to take it. And yeah, I was an addict, and I was involved in crime, and they caught me, and I got 7 years. I got 9 years. I got in with a bunch of violent people when they would do their crimes, and I got 20. One gangbanger was from a dysfunctional home, and his very best friend was also kind of on the streets with them. And he had joined a gang, and he said to this particular person, come on, come to the gang with me. It's a family. They love you. They give you everything you need. They care about you. So I joined the gang. Well, then my friend betrayed us. He went and told the cops stuff about us. Well, the gang knew you can't do that. That's not allowed. So they had to do a drive-by hit on him. Well, guess who gets to be the hitman? Me, because he's my best friend, and that would prove my loyalty. And as we drove by, I grabbed the gun, I went out the window, and I shot my friend dead, and I've been here ever since. That was when I was 19, and now I'm 52. Well, maybe he is a bad guy. He certainly was violent, and I certainly don't want my kids to have him as their best friend. But now he's 52, and he's teaching in the prison to other prisoners how to read and how to write. He's helping them get their GEDs. He knows he'll never get out, but he feels his life is fulfilled. So back to the car wash. Some of these guys, they didn't have such long stories. But one of them I remembered very well. I had met him down at the CRCI, Columbia River Correctional Institution. And they take a break in their meetings, and we have what we call, I know what we call them, I can't think of it anyway. It's where one-on-one, a prisoner and an outsider talk to each other. And we let them tell their story, and we tell them our story, and we communicate. We're trying to help them connect with the outside world. You know, they not only don't know about what's going on in school, they don't know about computers, they don't know about microwaves, they don't know about cell phones. And just to talk about what's it really like, a Max, you know, they don't know some of that. So I got one guy, and he came and he sat down next to me. He had this wonderful thing. He started telling me his story and how dysfunctional his family was, and how he got into drugs, and how he got caught, and now he's here, and now he's been coming to these inspirational, transitional meetings, and now he wants to change his life. And you know, he started shaking his head, and there were tears on his face, and he was saying, I don't ever want to come back here, I don't ever want to come back. And I said something about how long he'd been here. He'd been in and out for 19 years, he had been back 6 times. And he told me this whole story, and when he finished, they said, okay, everybody, back to your seats, and our time was up. And he reached over and he said, Ruth, thank you for listening to me. You are the first person that I have spoken to in 3.5 years that is not a prisoner or a staff person of the prison system. Well, he was at the car wash. I'll tell you, when he came up and he said, Ruthie baby, and he hugged me and I hugged him, I saw a new person. I mean, his eyes were dancing. He was smiling, he sat up stronger, his color was good. Everything about him was good. So I'm telling you some of these stories which, all the numbers, they're great. It's all true. But when you take stories like that and you look at it, and there's 14,000 of them here in Oregon, and there's 2.2 or 6 or 7 million in the United States. And the recidivism is between 50 and 67%. I did a little math. Where did I put those in? Here. In Oregon, 14,000 prisoners, 30% of them are predicted to be recidivism people. Oregon has one of the lowest recidivism cases in the country, status in the country. I found it interesting that we spend so much more than Alabama. Well, in Alabama, they do not humanize their prisoners. The horrific stories of beatings and rapes and poor food and inadequate medical care from Alabama are so heart-rending that thank goodness we don't have to talk about it. In Oregon, most of the prisoners tell me, of all the places to be incarcerated, it's better than in Oregon than in most other states. Do you kind of agree with that? It's a little better in Oregon than in a lot of other states. Maybe she doesn't agree. But I think there's a connection there. We spend more and prisoners feel more humanized here than in Alabama where they spend very little. Well, how do they save them? I just don't give them anything. That's easy. Okay. So I don't know where my time went, but last time I spoke to a group was Wednesday night. They gave me an hour and 20 minutes, and I'm trying not to do that. So I'm going to close up. I'm going to have some time for questions and answers. We're here until 3. And I want to point out, we are destroying our most valuable resource, and that's people. Free and reformed people, or those who can be directed away from crime before incarceration, contribute to our society. Prisoners and released prisoners who have not changed their attitudes, who have not ended their addiction, and who have not developed a way to earn a living that is honest, will cost the taxpayers money. The free people who have changed will find a job, get to work, and be contributing citizens. They will not be on welfare. They will not be in crime. They will not be back in prison. So I'm asking you, if you're recognizing the humanitarian thing to do, if you're willing to humanize prisoners and not look at who they are, and get rid of that idea that there's the deserving and the undeserving. And if you did a crime, you're undeserving. And if you're in prison, lock them up, throw away the key, they don't deserve anything. And so what if they don't eat right? And so what if their housing is inadequate? So what if their health care is inadequate? Doesn't matter, that's all they deserve because they are undeserving. And we, who are out here, we're deserving. Because I've never been to jail, I never committed a crime. Well, sorry, I think I'm just lucky. And I think they're unlucky. I think that you can push your luck a little, you can pull up your bootstraps and improve your situation, but this cut and dry, the deserving, the undeserving, help them, don't help them, throw away the key, that's baloney. So, recognizing the humanitarian thing to do, perhaps saving the funds spent on our so-called criminal justice system, and instead spending it on health, welfare, education, and other preventative programs, that's the issue to study. Thank you very much.